Gavi.org reported about a doctor who contracted Lassa fever, became very sick, and was hospitalized and recovered. The title of the article on Gavi.org is Health Workers Risk Their Lives as Lassa Fever Spreads in Nigeria. It was written by Hafiz Bolaji and published on the 27th of February 2025. So I'll read parts of what Hafiz wrote. The events of 17th February 2024 are etched into Dr. Divine Njaze's memory. He was on his usual ward rounds at the Federal Medical Center, Jalingo, Taraba State, northeast Nigeria, when his phone rang. It was a distress call from the Accident and Emergency Unit. He rushed over to attend to a female patient. In his hurry, he neglected to put on surgical gloves. No sooner had Njazi placed his hands on the patient than he discovered she was bleeding into her skin. He sanitized his hands after the session, but it was rather late. The safety oversight would prove costly as Njazi came down with symptoms of Lassa fever, a viral hemorrhagic fever, days later. Njazi recalled, "I had severe headaches, neck pain, high fever, itching, abdominal cramps, and a loss of appetite. My blood sample was collected, and after 3 days, the result returned positive for Lassa fever." Njazi continued, "I was placed on a high dose of ribavirin, which I couldn't commence immediately because I was having anuria, a low production of urine, or oliguria. After I was rehydrated, I was taking ribavirin 2 to 3 times daily for 10 days. Unfortunately, when the test was repeated, it was still positive, and I continued receiving treatment." He told Vaccines Work. As days went by, Njazi's health condition worsened. The kidney function test revealed he had renal derangement, he said, recounting the frightening moments he endured during his month-long hospital stay. Njazi continued, 5 Lassa fever patients were brought into the isolation ward on the first day I was admitted. Unfortunately, all of them died. The next day, 4 patients were brought in. They all died too. The patient from whom I contracted the disease died. Her father too contracted it and died after 2 weeks. His elder brother also contracted it but survived. At the point, I was alone in the ward, but after some days, patients started coming. When the test was repeated the 3rd time, it came out negative. I was discharged after a month and 1 week, he explained. The article goes on to say, despite his early traumatic experience, Njazi's commitment to treating Lassa fever patients remains unshaken. I've seen more than 6 patients recently. Even while I was on admission, by the 3rd week, I was the one attending to most patients on the ward. he added. So that's the story of Dr. Divine Ujaze, who came quite close to losing the battle to Lassa fever. And he got it from a patient who was called to attend to a patient in the emergency unit, and he did not wear his gloves when he touched the patient, and he got this Lassa fever. As he touched the patient was bleeding into the skin, which is one of the symptoms of the disease. You know. So this story highlights the importance of having personal protective equipment. You need a high index of suspicion, for you to know that when seeing some patients, it's appropriate for you to put on some appropriate personal protective equipment. Like a patient that's having history of bleeding, you want to put on gloves, you want to put on a face mask, and you want to ensure that you take other precautions as outlined in various guidelines that have been released by the Nigeria Center for Disease Control. You know. So it's important that the management of hospitals, it's important that employees of doctors, that they ensure that these things are provided. And at the same time, it's important as much as possible, if as a health personnel, if you could afford to get some things yourself that you can keep in your bag, you know, to protect yourself. It's also important. You know, while we urge the government, strenuously urge the government to ensure that they provide these things, and we urge private sector, private hospitals, owners of private hospitals, managers of private hospitals to provide these things. As a doctor, it's important to be cognizant of the fact that you need to take some actions to protect yourself. You know, it's important that whatever you can afford, if you can afford to get your face mask, your own, in case the one in the unit, the one in that hospital runs out, you do that. If is to have a box of your own gloves, and you seeing a patient and the one in the unit is not available, put on yours. This is not to encourage hospitals or management or government not to provide these things, but it's to be realistic, and to exercise personal discretion towards protecting yourself, because we know the system will run. If these things are provided, before long they run out. If these things are made available, before long they run out. So it's important for you to seek ways to protect yourself, and it's important for there to be demands made to the healthcare providers, those in charge of hospitals and facilities and all that, provide things through health personnel can use to protect themselves from contracting diseases like Lassa fever. As I've said before, Lassa fever presents like various many other diseases, and as such you need a high level of suspicion, you know, in order to take these precautions. And if the things that you need to take, if the PPEs that you need are not readily available, comes a challenge between choosing to save a patient's life and being careful to take care of your own health. You know. And so As someone who really wants to do your best to see that the patients are taken care of, there are ways in which you can also protect yourself. Don't fail to do that as well. And remember, if these things are provided, first always ask. As you are resuming duty, you ask if can you get a face mask? Are there gloves? Hand sanitizers, wash soap to wash hands, and all this is ask. Sometimes these things can be provided when we ask, and ask early enough so that arrangements can be made for these things to be provided.